AHSN is a collaboration really between clinicians, industry and academia, looking at ways that we can improve the care that we provide to the children in the region.
We have the opportunity here to build a really exciting network which brings together best practice across the whole of the region.
There's a lot of good ideas in hospitals and in the community setting, and there's a lot of time that could be saved if we can actually implement those ideas.
Being part of the Children's Network and working with other people who are equally interested and excited about sharing good practice and sharing research and enabling the region as a whole to be offered an equitable service is a really, really positive thing.
I'm very enthusiastic about the networking that we're putting in place with the AHSN because it allows us to look around the healthcare provision for children to see the best practice and then make sure that all of us are signed up to that so that we deliver it and completely transform the health of children in our region.
We know that doctors all do things a little bit differently, and even when there are well-established national guidelines on a specific condition, we know that personal preference, patient choice, various other factors lead to a gradual build-up in that variation, and what you end up with for a whole raft of reasons are big variations in admission rates to hospital for common paediatric conditions, variations within hospitals on how to manage each of those conditions, and as a result variation in outcomes.
Now those differences are all within completely acceptable norms, but what we'd like to do is to harmonise that across the whole region.
The Oxford Academic Health Science Network, which is hosted by Oxford University Hospitals Trust, covers a far wider area than just Oxfordshire. It covers Buckinghamshire, Berkshire and parts of Bedfordshire.
I think sharing is important because when the doctors share, they can share experience to make it easier for hospitals to build up on things and make them better.
Because things go wrong if the hospitals don't talk with each other.
I think it's a good idea to have a network between different doctors because everyone should get the same care no matter where they live.
I think that a child should expect the same approach to management whether they turn up to their GP or they turn up to an accident and emergency department. I think that the correct course of action is the correct course of action.
If we can ensure best practice and it's over the whole area and somebody's updating that best practice all the time, then we're going to provide the best possible care.
One of the things that the AHSN is hoping to do is to start to create regional guidelines which are agreed across the whole area that are used both by hospitals and also by general practitioners, so that wherever a child attends, they should be able to expect the same care.
One area of work we're looking at the moment is collaborating with an organisation that is putting the Children's Red Book, which records their progress from the time that they're born, electronically, and creating, as it were, an e-Red Book.
One of the things that the AHSN hopes to do is act as a sort of middleman or broker to try and reduce that length of time that it takes to bring new and exciting technologies to the patients.
As Children's Network nurse, our first project is about the children's flu vaccination and increasing awareness and increasing uptake across the region.
This is very important because children are super spreaders of flu, and by protecting young children we also protect their parents, their grandparents and others in the community.
This year in 2014 we've been rolling out influenza vaccine for all children between 2 and 4 years of age, but we've found that there's a big variation in the ability of families to access that vaccine.
What we did to start with was contact the practices who did really, really well last year. So some of them got 70%, and they were a variety across the whole region. It wasn't just in particular areas. And we talked to them about what they'd done to achieve such wonderful uptake, and we used that as best practice tips then to share with practices who perhaps hadn't done so well.
If we can hit the target, we will create what's known as a herd immunity or community immunity and offer widespread protection to all children.
Well, over the next few months, we're hoping to have established some infrastructure in each of the hospitals around the region for carrying out clinical research trials.
What do we have to take from your body sometimes to look at?
Blood.
We do. And how does your medicine help?
It helps. We have some energy.
Energy. Does that mean you can jump really high? Oh.
Our situation is quite rare in that they've been diagnosed with a combined immune deficiency. It was only discovered in June last year by another family in the north of the UK that have the same deficiency. Had it not been for the research that their family have gone through, ours wouldn't have been discovered. And if I hadn't have gone with my gut and let them do the research at my local hospital, I might not have my children with me today.
We care passionately about access to research for all children coming into the healthcare system. We know that where research is embedded within healthcare, the overall health provision and the outcomes are much better.
My condition wasn't obvious at all to me or to my doctor, and it took a process of a long time to know what I was getting. I was always ill. I thought it was just me, and I was always like, oh, I always felt down, and I wasn't actually enjoying school because I was missing so much. And as soon as I found out what was wrong with me and I actually started the treatment, everything started to go up, and now I'm actually feeling so much happier and I'm getting on with school, and everything's just a lot better when you find out what you have.
We want to see the same high level of care being delivered across the whole region, whether that is access to research, whether that is access to influenza vaccination, whether that is the care that you receive for common paediatric conditions such as pneumonia.
It feels today as if we're just at the start with an enormous amount ahead of us. So we have much to do, and we look forward with anticipation and excitement about the changes that we'll be able to make through the ability to network together.